Group therapy for bereaved children. The first question is, why? Well, first of all, let's think about the fact that any sort of loss or death is going to be difficult for someone to go through. It's a process of grieving, and for kids, they're going to be lacking the cognitive abilities, the life experience, the coping strategies, and probably the support system they need to really get through that season, that situation in a healthy manner. The support system that they normally have may be severely affected by the loss themselves. They may not understand what the child needs, and they may also just be oblivious to it. The second question we need to think about is who. So we're saying kids. Well, is that 1-year-olds? Is that 5-year-olds? For this particular group, I would want to do 6 to 12-year-olds. I would want to keep that age range. I would trying to keep them within the same developmental stage. Obviously, kids are going to be at different levels of development, even within the same age. But the idea is that from 6 to 12, they're kind of in the same developmental stage. They're going to be able to connect with one another, and it's also going to give the group leader a way to develop curriculum based on that age. It's going to keep it centered because developing curriculum for a 5-year-old and a 15-year-old can be really different. So we're going to kind of narrow it down, and 6-year-olds are going to be at a place where cognitively they're probably going to be able to process a little bit better in group and actually be able to participate in a beneficial manner. The next question we want to ask is, what are we going to do in this group? What are the goals of this group? There are a few. The first one, which is going to underline all the others, is reducing the risk of suicide. They may not understand the permanence of death, and they may see that as a viable option to see someone they love. They may also see it as a viable option to get out of the things that they're experiencing. So throughout this whole group, our underlying goal is to make sure that the kids don't see their own death as a possible means of escape, of problem solving, or any of that. So that's one of the goals. The other ones are to normalize what they're feeling by creating a safe space for them to process and actually understand and identify what they're thinking and feeling. For some kids, they might not be in an environment where they can even really identify what they're feeling, so we want to create a space for that. We want to educate them on death and on grieving and kind of what that looks like, especially a 6-year-old who knows what they've been through, but most likely they don't have the life experience to understand those things. And then we also want to develop coping skills for them to endure the losses that are going to continue to come in life. We want to equip them in such a way that they can grieve properly and healthfully in the future. So when we look at forming the group, there are a few things to consider. One is, ideally, I think this would function really well in a community health organization. When families come in experiencing loss and don't know what to do with little Johnny, this would be a time for the family's therapist to refer them to this group, to suggest this group, and to offer it to those families as a support system, alternative, supplement, not alternative, we'll say supplement. There would be a screening process. One, you want to screen and make sure that the kids are cognitively able to participate in the group, that they would be able, they're at a place where they're healthy enough to process with others. If little Johnny comes in and going to group therapy and everyone talking about the deaths that they've just experienced is going to re-traumatize him, it may not be a safe place for him. So that's part of the screening process, is to see, are they going to be able to share? Are they going to be able to understand enough that it's going to be a benefit? The other thing to look for is signs of post-traumatic stress disorder, because the research shows that if a child is experiencing PTSD, group therapy is actually not going to be a benefit, and that would be something that needs to be addressed in individual counseling. Also informing the group, obviously these are children under the age of 14, so they would need to be brought by their parents or caregivers, and confidentiality needs to be discussed with them. What stays in the group, what do you discuss with parents? The line that I would want to follow would be, what the kids say in group stays in group as much as possible. They are kids, so you'd need to let the families know. We can't guarantee confidentiality. We can't honestly guarantee that little Susie isn't going to go home and tell a story about little Johnny. As much as we can stress that, as much as we can educate the kids throughout the process, that's something for the families to be aware of, because some of these situations may be sensitive to the families, and they need to know that as much as we're going to stress that, it's possible that it might not be private, because we all know how kids like to talk. The other thing to consider in that is we want to keep everything in group unless something comes up that needs to be addressed by the caregivers. I was reading an article where the parents said, Johnny did not see anything he didn't even know until we told him, and then something came up in group where it was obvious that Johnny did actually see the death, and so the group leader had to figure out, okay, is this something I bring the family into, or is it something that we address in group without me, re-traumatizing the family? So that's something that the group leaders going to need to be aware of and sensitive to throughout the process. They're also going to need to be sensitive to cultural differences. These kids are going to be byproducts of whatever cultural influences they're coming from, and they may be different. So this is a time not only for the group leader to help kind of guide and direct, but also to educate when there's differences. There's going to be differences in grieving. There's going to be differences in what we're sharing and how we feel comfortable sharing, and working with the kids on addressing that and having levels of respect and understanding and empathy. This could be a really good venue to equip kids to have empathy and have understanding as they encounter other experiences in life. So we need to figure out what the actual structure of group looks like. This model that I've come up with is actually kind of taken from a model I saw in one of the articles, and then some of the things I saw in other articles, and kind of merging of all those understandings. So ideally, we would have 10 sessions, and the first 7 sessions would be every week, and then the last 3 would be bi-weekly. And that comes from the rationale that we want to kind of transition the kids into another season of loss. When group therapy ends for them, they're going to lose a support system, they're going to lose something again, and we want to acclimate them to that. So you'd have session 7, then you'd have 2 weeks, session 8, and so on and so forth. Session 10 in and of itself would be unique because that would be a session for the child's primary support system, their caregivers, their parents, whoever brought them to therapy, whoever is going to be their support system after therapy, would come in, and that would be a session where we would share. The children would share where they've been at, what they've learned, and where they're going to go from here. So that's a time for the support system to recognize that, to see where the child is at in the grieving process, and to step in and actually become the support system with knowledge about what that child might need. Really important to keep in mind about all of this is that kids are different than adults. I know that's a given, but sometimes I think we approach things and we go, oh, this works here, so it'll work here. But for kids, they don't necessarily process and talk therapy. They process, they learn, they develop as humans, as little human beings, through play and through activity and through symbolization and all of that. They might not even understand what they're representing through symbols sometimes, but that's one of the ways that kids process. Little Johnny and little Susie coming in might not even be able to tell you exactly what they're thinking or feeling. So that's why these sessions would incorporate lots of drawings, lots of activities and games, because that's going to be a way, one, for the group leader to kind of maybe get some insight into where the kid's at, and also for the kids to start identifying. That's why we do a lot of drawing things. We do a lot of interaction, because if we just sit in a group for an hour and ask questions, the kids aren't necessarily going to get anywhere. So we want to take that into consideration. We want to be sensitive to that. We want to be willing to be flexible. As much as structure is an important aspect to this process into developing coping mechanisms, education, and helping these kids, we also want to be flexible to the needs of the kids and to their attention spans, because that is actually something to consider. In the end, group therapy for bereaved children is something that needs to be continually researched and developed within our profession, helping kids experience loss and developing coping mechanisms so that they can continue on in life as they continue to experience loss is really important and necessary. So these are just some ways that I think that we can develop that. It's something that I actually one day hope to do. I actually really want to sit down with a group of children and help them process some of the most traumatic and stressful events of their life, and one of those is usually death. So my hope is that this gives you a little insight into a need that we have within our profession, and also maybe gives you some ideas about what you could do as a therapist as you go forward. And thanks for listening.